Now, to the latest on the first case of Ebola in the United States, and it turns out patient zero may have lied on a questionnaire before flying to the US from Liberia. Liberian officials say Thomas Duncan said he hadn't cared for any Ebola patients when he had, in fact, helped an infected neighbour a few weeks ago. Officials say it's too early to say whether he may have transmitted the virus to anyone else in the US. Our Song Ji-son reports.
Was it an intentional lie, or had he really not known? It has emerged that the first confirmed Ebola patient on American soil, Liberian national Thomas Eric Duncan, answered no to questions about whether he had cared for a patient with a deadly virus upon his departure from his home country. The Liberia Airport Authority said Mr. Duncan also checked no to a question about whether he had touched the body of someone who died in an area affected by the virus. But reports say he was seen carrying an infected woman who went on to die a day later. The 42-year-old was visiting the U.S. for the first time to see his family and friends. Soon after he arrived in Texas, he visited the emergency room with a fever and told a nurse there that he was from Liberia, but he was sent home with antibiotics without being screened for Ebola. Hospital officials have acknowledged the patient's travel history wasn't fully communicated to the doctors. Before returning to the hospital 3 days later, up to 100 people may have come into contact with Mr. Duncan, and about a dozen of them are thought to have come into close contact with him. The U.S. Centers for Disease Control and Prevention says no one has tested positive for Ebola so far, but symptoms can appear up to 3 weeks after exposure. The CDC on Thursday issued guidelines and care methods to hospitals across the U.S. on how to deal with a patient showing symptoms of Ebola. 송지선, 아량 뉴스.